Magnolia State Family Medicine, Health Center and Medical Spa, 1009B City Avenue North, Ripley, 587-8176. Call for your appointment. Providing modern medicine with Southern hospitality. That's Magnolia State Family Medicine, 100% veteran-owned and operated. Bethel University Physician Assistant Program affiliated. Magnolia State Family Medicine. Dr. Christopher J. M. Cummins, Medical Doctor. Fast, hot, and fresh. Open 24 hours just for you. Dodge's Store. Come be our guest. Dodge's Store, Ripley. We are 100% employee owned with friendly service and a fun atmosphere. High quality, low prices. We are Food Giant. Our deli serving breakfast, lunch, supper. Food Giant, 702 Highway 15 North, Ripley. Come shop Food Giant. Want fresh meat and fresh produce? Food Giant's the place. High quality, low prices, Food Giant. Now welcome to Ask Dr. Cummins. Please call 587-8176. Ask Dr. Cummins.
Welcome tonight to the Ask Dr. Cummins show. Good afternoon, Doc.
Good afternoon.
Everything going, like you said, had a beautiful day.
Beautiful day in the neighborhood.
I'd like to make two announcements. First announcement at 587-8176 is the phone number you can call and get your questions medically answered by Dr. Cummins. He'd be more than happy to field your questions and give you answers. He has an office here in Ripley. Another announcement is he is now open on Saturdays from 9 o'clock in the morning to 4. Is that correct,
That's
Doc?
correct.
Matter of fact, I think you're the only doctor's office open on
that
I know of.
Yeah, I believe we're the only place in the county right now that's doing that, and it's worked out real well for our patients and other people that have had, in lieu of going to the emergency room for a cold or a cough or something, they've come to see us, and so I think we're filling a niche and a need that the community needs.
I've been in that situation before personally, where you had to have some medical attention on a Saturday, and you know, you don't have a choice if you got to go and you think you're sick and you got to go, and we hadn't had, but now you've offered us, so we appreciate. I'm sure the community will show appreciation for that, and that you're open on Saturdays. That gives us a good outlet.
And I tell you, I was speaking to the hospital administrator yesterday, and the ER here, as well as a lot of other ERs in the United States, are doing I forgot the exact name, but it's a kind of triage system.
Well, that was one of the questions. They just came out, not in, but that was one of the questions. Explain that, because it was in the newspaper.
Oh, it was, okay.
Showing that they're going 3 different, but go ahead and explain that.
So,
That'll be the first
basically, what it is, there's certain criteria that must be met to be considered an emergency. And if you do not meet that criteria as a patient, you may be asked to pay a certain amount of money up front before they'll see you. So they're not going to necessarily turn anybody away, but you may kind of self opt out if they don't think you're going to meet criteria for an emergency. And so hopefully, you know, if that's the case, or if you don't think you're going to meet criteria, we'll have a place there for you.
So let me kind of get that, put in my old dumb terms. If I go to the hospital, kind of the way I understood it, if I'm, let's say they have 3 levels. All right, well, let's don't talk. If I'm sitting there and I've got the flu and I start coughing and I just want to see a doctor and get some antibiotics and get a shot, and I go to the emergency room, they're going to come out and tell me, that's fine, this is not an emergency. So in order for us to proceed, for you to see the doctor, we'll need $100. Something to that.
I think it's going to be 75, but the
whatever.
But the deal is where it'll probably be based upon your vital signs, blood pressure, temperature, respiratory rate. From what I understand, this is very much evidence based, so it's not arbitrary decision making. And it is certainly going to be in the patient's best interest, but also in the best interest of being good stewards of the services that we can provide, because the end sum of the ER game is, they want to be there when you have your heart attack. You do not want 12 people in front of you when you have your heart attack with a sore ear or a sore throat.
Or want an antibiotic or a shot.
Something like that. Not saying that they may, that's why there's a strict guidelines that they'll follow. And I think if it's implemented well, will only serve patients and the community in a good manner.
Well, that is something new, and that was one of the questions. Explain that. So that was me. Well, you got to start it off.
We're up to date.
I had two questions, or two people that asked kind of, one person and I'm making an assumption, just strictly, I think they're probably fixing to go through hip surgery, and that's why they asked. But let me kind of field you on the hip surgery, or the hip questions first, if you don't mind. Let's see. Well, please explain the new policy in the ER. There it was right there. So we answered that one. The first question is, how long should a person wait before deciding on hip replacement surgery?
It's a good question. I'll preface it by letting you know, in areas where there's already full socialized medicine, such as Britain, the United Kingdom, if you're over 80 years old, you don't determine it. The system determines it for you, and if you're over 80, you do not get a hip replacement. No matter how spry and well you are, you just don't get it. I can also let you know, in Britain, with socialized medicine, if you do break your hip and you're under 80, the average wait time to get your surgery, should you desire it, is 18 months. So
Wow.
you're bedridden for 18 months.
Wow. And there's no choice or no option.
No options unless you go pay for it out of your pocket somewhere. And I don't know if many people have 30 or 40 grand sitting at, to do that. But to address in America right now, when we want hip surgery, if we decide, basically your determining factor to get hip surgery or a hip replacement will be that it is just, the pain is no longer bearable from arthritis. You just can't walk, you're just miserable. Or you have broken your hip and you need a total replacement because it's fractured. And basically, if you're doing well and you meet guidelines again for surgery, sooner the better, especially if you fractured it. And but with arthritis, it's just going to be to the point where you just can't stand it anymore, and you're just so miserable. The big way, because our goal is to keep one moving. You want a patient moving and mobile.
In little pain or no pain.
Correct. So the patient kind of determines it from an arthritic standpoint. The surgeon and the patient with a broken hip will determine it together. But usually they're going to act really swift to go ahead and get that done. And obviously, the younger you are when you break your hip, the better off your odds are of healing afterwards.
Yeah.
There'll be a lot of people who are doing pretty well till they break that hip. They break the hip, and then they come out of surgery okay, but then they die because of that body stress to surgery.
It's kind of a pattern I've noticed in my brief experiences in life, and now they're getting to be non-brief, but extended, that seems to start a chain reaction to a lot of bad things happening. And most of the time, they make a big joke about it. Help, I've fallen and I can't get up. Yeah. That's not a joke.
No, it's not a joke.
It's not a
and
joke.
That's the reason why we're so big on doing the DEXA or bone scans to check for the mineralization of the bone, particularly in women who tend to not have a thick or a much bone density as men do. And getting people on recommending those calcium supplements with vitamin D and doing the reclassed infusions like we do in my practice. It's that once a year treatment for osteoporosis.
Another question the fellow, this was a male.
Okay.
Another question he asked, what are the advantages of hip resurfacing compared to hip replacing?
That's kind of a newer terminology for me, hip resurfacing. But the only thing I think that would be going in and doing a scope of the knee when they kind of clean out or shave
Well, I
the
think
rough
he
edges.
mentioned that he says it's kind of like a scope.
Right. And, you know, that would probably be real helpful if you have like some arthritic damage and things like that. But if you fractured it,
If it's not broken, I guess that's what you
Right.
ought to try to do,
They-
right?
maybe.
Yeah.
It probably depends on how severe, because if you have really bad, severe degenerative arthritis where you have erosions in that bone, where it just is gone, you may just need the replacement. But if there's just some rough notches or what we call osteophytes, little bone growths, they're going to shave it, make it a little more smooth, and it should articulate or meet real well together, and should be okay. And if you always, you know, less would be more in that
Yeah.
instance if possible.
All right, then he went, how much pain, and of course, nobody can answer that really, but how much pain will I feel after replacement, and then what is the best way to manage it? I think he was getting at, he don't like to take pain pills.
Right. There is some pain certainly involved in that. Usually for the 3 to 4 days immediately following, your orthopedic surgeon is going to have you loaded with pain medicine. Well, that will not be a problem. The only problem you may encounter is being constipated because the pain medicine slows down your bowel movements. But they usually take care of that as well. But again, after surgery, the goal is to get you back moving. And the sooner you start moving, the sooner you start feeling better, and the easier your pain it will be to control. And then you will experience, as you go through physical therapy, some soreness. But soreness is really different than pain. You should work toward soreness, but not toward pain.
There's several more questions, but I think we spent enough time. Well, let me ask one more in this quote series that he asked.
Right.
What can be done to extend the life of my total hip replacement? In other words, he's kind of wanting to say, what's the life expectancy of a total hip replacement? Is it till I die? Is it for 25 years? Is it for 5 years? And he says, understanding, I know it degrees on your activities and your activity levels and things of that nature, but how long can I expect my total hip
I believe that the average is about 10 to 15 years. But they keep coming out with more and more progressive pieces of metal and stuff to use in them hips. And somebody told me they're coming out with a 20 or 30-year knee. So the hip's probably not going to lag far behind that.
Okay.
So I'd say 10 to 15 probably a good estimate right now. But
All things, health.
But if you fracture it, you don't really have much of an option.
Yeah.
Unless you
Well,
just
that's right.
decide to stay in the bed.
Don't walk,
And that's not a good option.
Question, grandmother asked, a lady's grandson has nodules in his breast. Surgery is scheduled. What causes this, and is it common that surgery is the only option to treat it?
Well, it's a good question, and we've actually recently encountered this in my practice. Surgery is not always necessary, but if a surgeon has finally deemed that it is necessary, that's the thing to do. But it's a stage that you do with nodules, particularly in men and women, really for that matter. There are certain algorithms or pathways that we follow that are best case or best evidenced recommendations that you do. And in our instance, we had a patient come in with that, young male. He had what we believe is due to trauma, where he'd been hit, repetitive motions at work, and we did some anti-inflammatories. We did, I believe, some steroid injections on him, and had some minimal improvement, but eventually it led to an ultrasound and things like that. So I think this patient's probably not the one we've seen because they're a little more advanced.
They said the board's set up for schedule.
Yeah, so they're
So
more advanced
scheduled
on down the
surgery.
line. And that's what our patient would probably eventually be arriving at, because they want to make sure you don't have cancer.
Right.
And a pathologist taught me a long time ago, if cancer is the issue, you must biopsy the tissue. So that's what they're going to be going for, is get a piece of that tissue and make sure that man does not have cancer, or rule it out as best as possible. So sounds like the right thing to do in that instance for sure.
Okay, well, I hope that answers your question on the grandson. this man called up and he's, of course, he's had the diagnosis and he knows what he needs to do, but he's scared to death. It says the man was diagnosed with cancer in his ear. He just keeps on having terrible headaches. Surgery has been suggested, but he feels like it's just too close to the brain, that he wants second, third opinions. He's real scared. How should this man, what should his reaction? Can you give any recommendation?
I can just only give him the recommendations that I would give my patients, and those same recommendations I would give to my mama and my daddy, okay, somebody I love and care about. And that would be, if you're scared and that sounds like an over-aggressive form of treatment, certainly get a second opinion. But don't dwell on it and wait and, opine to yourself, oh, this.
It could go to the brain.
Yeah, you need to go ahead and do it and get that second opinion, make a decision, and 'cause let me tell you, even if that lesion or if it is a cancer that's close to the brain, it's only going to get bigger and get worse. So you're only prolonging the inevitable and making probably surgery, if that is the option, more difficult for the surgeon, therefore more difficult for you to have a good outcome at the end of it. So don't wait. If you want that second opinion, go get it. If you want third opinion, go get it. But at some point, you're going to have to make a decision. Because if it is a cancer, it's only growing. Cancers grow usually pretty fast.
All right, thank you, Doc. Well, Tony, we're ready to take our break. We'll be right back after we hear from our sponsors.
Magnolia State Family Medicine, Health Center and Medical Spa, 1009B City Avenue North, Ripley, 587-8176. Call for your appointment. Providing modern medicine with Southern hospitality. That's Magnolia State Family Medicine, 100% veteran-owned and operated. Bethel University Physician Assistant Program affiliated. Magnolia State Family Medicine. Dr. Christopher J.M. Cummins, Medical Doctor. Fast, hot, and fresh. Open 24 hours just for you. Dodge's Store. Come be our guest. Dodge's Store, Ripley. We are 100% employee owned with friendly service and a fun atmosphere. High quality, low prices. We are Food Giant. Our deli serving breakfast, lunch, supper. Food Giant, 702 Highway 15 North, Ripley. Come shop Food Giant. Want fresh meat and fresh produce? Food Giant's the place. High quality, low prices, Food Giant. Now welcome to Ask Dr. Cummins. Please call 587-8176. Ask Dr. Cummins.
We're back on the Ask Dr. Cummins show. Telephone number 587-8176. Give that number a call with your question, medical questions, and Dr. Cummins will be I'll be more than happy to ask it, and he'll be more than happy to answer it. So give us a call. That is a 24-hour number, so you can call that number, and if you don't get a person, you can leave a message with your question, and we'll be happy to try to get it on the program for you. We got a special treat this afternoon. Along came Miss April Robbins. You'll see a lot of her when you go in to see Dr. Cummins. April, good afternoon.
Good afternoon.
You are what they call, your official title is an advanced practice nurse.
Yes, sir.
Or a nurse med.
Nurse practitioner.
Nurse practitioner, okay. Now, give me a little explanation of your duties.
I work with Dr. Cummins on a daily basis. I go in and introduce myself and try to speed along the process of diagnosing and seeing what you need before he comes in there.
I've been in Dr. Cummins' office before, and you've come in when I was there, and you brought in your computer and asked me a lot of questions, and I guess you were trying to get a good history of what was going on with me.
Yes, sir. We're trained to diagnose and treat a wide variety of different diagnoses, and
You basically can run the shop. if the shop foreman ain't there, you basically can run the shop, can't
Yes,
you?
sir. Yes, sir.
Well, in your quest to do this, and I guess it was a lifelong ambition that you had to quote be in the medical profession. What led you to arrive at the decision that this is what you wanted to do in your life?
Well, I'd been around medicine my whole life. My mother was a nurse, and so I traveled with her when I was small, and it's just something I've always been interested in, and I've always enjoyed. So medical field was just something that I wanted to pursue, and I was a nurse for probably about 4 years before I decided to go to nurse practitioner school. And I went
Now, when you say you were there, were you here locally? Were you?
I'm originally from Myrtle. I live at West Union.
Okay.
I actually had my own practice there for 7 years
In West Union?
at West Union.
At West Union.
Uh-huh.
Had a clinic there?
I did.
As
I
a
did.
nurse med type
A
clinic?
nurse practitioner.
Okay.
Mhm.
I don't know,
And-
I keep nurse med. Is there a difference between nurse med? I need to answer that for me. Is there a difference between a nurse practitioner and what I'm calling a nurse med?
I'm not familiar with the nurse med. I know there's a clinic here that's nurse med, but I'm not sure if
There's two, and they call themselves nurse meds.
Okay. They have to be probably nurse practitioners like I am. Now, they
Okay.
are physician's assistants.
Oh, yeah,
Also-
well, now they have to have a physician.
They work under the license of a
That's right,
physician.
they're working under,
Nurse practitioners carry their own license. However, in the state of Mississippi, we have to have what we call a collaborating physician that we collaborate with. Like at the practice I had, Dr. Cummins would come usually once a month, and we had like a quality assurance protocol we'd go through, and we'd review like usually 10% of the charts. And you know, he would advise me on certain things because, of course, we don't go to medical school. I went 7 years, so I mean, we're capable of. We know what we can pretty well treat, and
Well, that's my
there's
next-
some stuff that we just don't know, and so that's why the physician is.
so
good there.
you were at West Union, in your experience, you were at West Union for about 7 years in
7
your own
years.
clinic, and then that didn't mean to interrupt you, then carry us a
Well,
little further
I
on.
had 2 boys. I've got a 4-year-old
sons. There
and
you go.
I've got a 12-month-old, and so it's really difficult to own a practice and
I
have
imagine it
kids.
is.
And so I come with Dr. Cummins in November, I believe, is when I come here. So when I sold my practice, and
Okay, so
I'm happy.
you had a clinic in West Union,
Mm-hmm.
and you sold that out and have moved. You hadn't moved. You still live in Myrtle,
I
right?
do.
But you are full time now here with Dr. Cummins.
I'm usually here on Tuesdays, Wednesdays, and Thursdays.
And I guess maybe one of your positions. I'm just stabbing at the dark here, but would one of your positions in Dr. Cummins' clinic be to oversee the what we call the Bethel students that come out?
They do follow me around sometimes. We have Miss Brandy Patton. She just recently
She was on
come
the
to
show
us.
about 3 weeks ago. That's
She
right.
usually tags around with us to see what I can show her since I've been around for. I
Right.
don't think she's much older than. Well, she's actually younger than me, but I got out pretty young. I was 25 when I
Where
graduated.
did you get
so
your?
I went to
training?
Northeast for my RN, and then I went to Mississippi University for Women for my master's, and that's
MSCW. Well, that's what I used to call MSCW. I guess it's now.
That's a really good school.
That's in Columbus.
Uh-huh.
Okay, we used to call that MSCW.
Yep. Okay.
Hey, you probably too young for
They
that.
said it's Mississippi University for Women and Smart Men too. That was always,
Well,
that
yeah,
was always
right.
the slogan. So
Okay, so how long did you go? How long did you spend? I've asked the other Brandy. How long did you spend in school to be able to obtain the position or the accredited service you can provide to people? How long did you spend in
it took
school
me
to study for that?
7 years.
Okay, you got in other words, you got a regular degree the first 4, right?
I got a bachelor's
In what?
in science nursing.
Okay, so did it have to be medically related, or
Yes.
could it have been like in business, or
No, it has to be
sports.
medically related.
has to be medically related? So you go.
They may change that though, so y'all don't need to let them change that.
Okay.
Because they're fixing to pass a law to where if you have a bachelor's in anything, sometimes you can go on, but you're supposed to have had some kind of medically related bachelor's, and you're supposed to have at least 2 to 4 years experience as a nurse before you can go to nurse practitioner school. So
Okay. So with that in mind, a person that had that in mind to do what you're doing could look to spend roughly 7 years in school, and there's no shortcuts, is there?
No,
I guess you can go to
I
summer
started
school.
when I was 18, and I went straight through, and I was 25 when I got out. That was my goal. So.
Do you have to maintain a certain grade point average? I guess you do to stay in school, but I mean, do you have to?
You have to have at least a C average, or they fall you back to the next. That's what's considered passing. It's not like an F and you make an F and you
Right.
get through. You have to maintain a C.
Did you have to do any quote what I call residency, or what the term I'm using is residency? How long did you have to?
We
Is that
do-
inside the 7 years, or is that outside the 7 years?
Part of it's outside. While you're inside, you do around 200 hours of what we call clinical, where we go to different fields. You can choose you have to choose one specialty to go to. I did neurology and wound care, but and then when you get out, you have what they call 90 days or 720 hours where you have to practice with another nurse practitioner or physician, and that's kind of like your residency when you get out.
Okay.
And you're required by law to do that.
In your rounds that you make on a day-to-day basis, what has been one of the most heartbreaking situations you've been in? That's a tough
Oh,
question.
goodness.
That may not be fair to ask, but I'm going to ask that question.
Just a lot of the things is like the economy being like it is, and a lot of people having a lot of different financial aspects to where they've lost jobs, and then they found out that they're
Lost
they're
insurance.
sick or ill or something like that. But Dr. Cummins is he's really good about working with people that need care.
Well, when people lose their insurance, they lose their insurance for whatever reason. I actually don't believe anybody actually on purpose loses their insurance. There are mitigating circumstances in each individual situation. And it's a tough life situation. But in your rounds, you don't actually give the shots or stuff like that. You have other people there that do that, but you actually are the
We
one
do.
making the decision.
I know how I can, but usually my time's utilized doing other things like diagnosing and helping. I help Dr. Cummins with a lot of different procedures that he does, with the Suparts injections on the knees, and I help him do different, skin biopsies and stuff. So I get to do some
Like,
stuff.
could you take out an ingrowing toenail if you had to?
Yeah. He can pretty well. Nurse practitioners, if it's on the toes, a lot of times we don't do surgery. We can, but I can do sutures.
Well, that's a stupid question. I shouldn't ask you that.
I can do cryosurgery. I know how to freeze different lesions. We can do a whole. I can do small like punch biopsies. I can do different biopsies and things, but Dr. Cummins does a really good job on it. So.
I would imagine if I was in your shoes, the children would be the tough part to see a child sick.
It is.
I'd have a
It
different
is.
kind of sympathy to that.
My heart goes out to kids, and you see a lot, and
And they're
You
looking
form
up to you. They're
relationship
looking
with
up to
them.
you to say, "Hey, make me better.
I
make
know,
me
I
well."
know.
Well, I'm gonna tell you what. We're about out of time. Is there anything else that you would like to say before we leave?
No, I'm just looking forward to seeing everybody, and I've enjoyed meeting a lot of new people. I didn't know a whole lot of people from this area until I started working there, and so I've made some nice new friends since I've been there, and everybody's been really nice.
Well, Myrtle is not like New York City. I mean, we're
No.
not. It's not like you were
Everybody
growing
knows
up out of the
everybody.
area. You know. Did you graduate from Myrtle, or did you go to
I went
West
to
Union
West
and
Union.
graduated from West Union?
I was at West Union.
Okay, so you went to West Union now.
Uh-huh.
Okay, that's
Yep.
going towards Oxford, right?
It is on 30 West, about 7 miles out.
Outside of
I've
Oxford.
lived on the same hill all my life.
That's where you go around the big curve right before you get into the straightaway, isn't it? Going to Oxford.
It's about
It's
20
kind of
miles
got
out
a
of
big
Oxford.
curve. Yeah.
It's right by, there's a school there called West Union School and West
Yeah.
Union Grocery, and it's there.
Okay. Well,
blink, you miss it.
April, we're certainly glad that you joined Dr. Cummins' office. We know he's real proud of you, and we know you're real proud to be here, and we're real proud to have you.
Well, thank you.
And we look forward, even though we'll be sick when we see you, we look forward to seeing your smile and trying to help us get better when we come.
Well, thank you.
Do not forget that Dr. Cummins' office is open, and you'll be there on Saturdays, right?
Some Saturdays,
Some Saturdays,
I
I
will.
guess y'all will have a swing shift.
Uh-huh.
But do not forget that Dr. Cummins' Saturday hours are 9 to 4. And if you have problems on a Saturday, let's say you had something happen during the week and you decided to go to the doctor, but you couldn't get there, well, you can now, because between the hours of 9 and 4 o'clock on Saturdays, Dr. Cummins' office is open. We do this show every Thursday night at 6:30, so please tune in again next Thursday night at 6:30. The phone number is 587-8176. Give it a call with your questions. This is Lee Allen Pegram, along with April Robbins and Dr. Cummins, wishing you a safe and healthy week ahead. We'll see you next week.